Hello, everybody. Thank you so much for coming. We're really excited to have everyone on the Zoom today to talk about our theme here, Kidney Health is Community Health, in honor of APOL1 Mediated Kidney Disease Awareness Day. And if you don't know what that means, don't worry, we'll be talking about that very soon on the call. But we're really excited that you're all here. We have a great team here from EMBARK. We'll tell you a little bit more about what that is and some wonderful speakers that will cover different topics about kidney health and community health. And so a few just housekeeping things. As the presenters are speaking, please make sure that you're muted. Feel free to keep your camera on and off, but make sure your audio is muted as we go throughout the event, just so we have no disruptions. We have a few speakers and we'll do a Q&A after each speaker and also have a full panel discussion at the end. So feel free to put questions in the chat, and then after each speaker, feel free to also unmute yourself or use the raise your hand feature, and we'll be sure to call on you. And I'll be moderating those questions, so I'll make sure that those questions get brought up to our speakers as well. So yeah, we're gonna go ahead and get started. So I'll start with a little bit about what EMBARK is and who we are. And so EMBARK Awareness is a nationwide program that aspires to raise awareness and provide education in Black and African American communities about kidney disease. And so EMBARK stands for Early Measures in Black African American Communities to Raise Kidney Disease Awareness. And so they do events nationwide, screening events, and they partner with different community organizations to educate and do these screening events in specific communities. But we also aim to build a community of providers and build a community of students who are passionate about addressing kidney disease disparities. And so that kind of brings us to our event today. And so we're working on building out many programs for students, including like mentorship programs, research opportunities, opportunities to volunteer at our screening events, and then also virtual education events like our event today. And so again, we put today's event on a special day, April 29th, because as mentioned before, it's APOL1 Mediated Kidney Disease Awareness Day. And so I wanted to introduce LaVarne Burton, who will tell us a little bit more about what that is. And so before we do that, a little bit more about LaVarne. LaVarne Burton, she's the president and chief executive officer of the American Kidney Fund. She has led AKF, which is the American Kidney Fund, since 2005, propelling the organization to many notable milestones to support the 1 in 7 Americans living with kidney disease. So they have programs to address early detection, kidney disease management, financial assistance, clinical research, innovation, and advocacy. Ms. Burton previously served as the executive secretary to the U.S. Department of Health and Human Services, where she managed policy development and regulations and was also an advisor to the secretary. Before that, she served as Deputy Assistant Secretary for Budget Policy at HHS and as a Senior Analyst to the Budget Committee of the U.S. House of Representatives. She also was the President of Pharmaceutical Care Management Association, PCMA, which is a national trade organization representing pharmacy benefit managers. Ms. Burton received her Bachelor's of Arts degree from Howard University and also a Master of Arts from George Washington University. And from there, I'll let Ms. LaVarne Burton take it away.
Okay, thank you so much, Eunice, and thanks to all of you for including me in this discussion tonight and for observing AMKD Day, APOL1 Mediated Kidney Disease Day. This is the second year that we are observing this day, and we're so appreciative of you and of the time that we have to talk about what's going on and what you as students and future students can do about improving health in our communities and specifically around kidney disease. So let me tell you a little bit about AMKD Day. Obviously, this is a fairly recent discovery and not very well known. And you might already know the statistics that this is a disease that results from mutations in our APOL1 genes. And if you have 2 mutations, it puts you at much higher risk of getting the disease. And it is a very rapidly progressing form of kidney disease. So there is a great deal of urgency about increasing awareness of it and about giving people the tools, as best we know them, that they can use to deal with this disease because it does progress so quickly into kidney failure. And it often happens when people are very young and appear to otherwise be happy. So last year, we kicked off this day with a number of observances on Capitol Hill with our presentations here at the National Minority Quality Forum, with the radio media tour. And we're doing much of the same thing this year. This past weekend, we had a town hall meeting with a Congressman Glenn Ivey from PG County here in Maryland. There's an article that we've sponsored that's in Essence magazine. We're doing everything that we can to get out the word about this disease, and we appreciate partnering with you in this opportunity to do that. Now, as you also probably know, kidney disease is a major issue for people of color, and particularly Black people. And it's not just kidney disease, it's really kidney failure. All people get kidney disease, but Blacks are 4 times more likely to progress to kidney failure than whites. And this is something that, that we struggle with. Why is that? Obviously, there's some things that have to do with our health care system and inadequacies in the system. It has to do with levels of high blood pressure and diabetes in the Black community. But increasingly, we're also focusing on rare diseases. AMKD is such a rare disease. And it appears that may account for a great deal of the disparity. A lot more research has to be done. But we know that that about 13% of Black Americans have these 2 gene mutations and therefore are at very high risk for developing APOL1 mediated kidney disease. And we know that about 1 in 5 of that 13% will progress to kidney disease, chronic kidney disease, and that many of them will move on to kidney failure. So it's really important for us to work together to arrest this. Unfortunately, now there are not specific treatments. There are some in the pipelines, and in fact, some clinical trials that are very close to being completed. And so we look forward to the time when there are treatments. But right now, increasing awareness, education, having people to work with their healthcare providers to manage those conditions that they can to hopefully slow down the progression, managing high blood pressure, managing diabetes. But we have some other issues in our systems as well. We have challenges that, social drivers of health. We have challenges with access to the healthcare system, all of those things that we need to continue to deal with. And the American Kidney Fund is dealing with this from many different perspectives, not only in terms of our education programs and working with various groups that have similar interests and goals, but also our policy advocacy with and on behalf of patients. We know that patients themselves can be the best advocates and so for themselves. And so we spent a great deal of time working with identifying people who are experiencing the challenges of kidney disease, and specifically in this case, AMKD, and with training them to tell their stories, with giving them media opportunities, and with help taking them in to talk with legislators and other influencers at all levels of government, federal, state, and local, because we want to build an understanding of kidney disease and of AMKD in the broader health community, and particularly among decision makers. We also are supporting legislation that would lead to efforts to use genetic testing to determine whether one has AMKD. Genetic testing is, in fact, the only way of verifying whether or not the person has these gene mutations. And their genetic testing is not always easy to get. As our patients tell us, many of them have jumped through all kinds of hoops, but there are some opportunities. Some people have gone to some of the more general kind of genetic testing to find the answers. Some of them have had help from local groups and from their providers in finding that. And so we want to continue to support those efforts, but we also believe that there should be legislation that provides for Medicare support, Medicare funding for genetic testing, so that we can get to the bottom of knowing whether or not a person has kidney disease, or whether or not a person has AMKD. In the meantime, we continue to work with all organizations that reach out to work with us, and that we can identify, just to get this information out. And so your work here is very important. And I know as you move into your careers and think about what you will be doing, I hope that you will consider really focusing on this area and the needs that are in this area. There is so much need for innovation and additional research in this space, and we certainly as a group support that. We are concerned as well about funding for public health programs, Medicare and Medicaid, because so many people dealing with kidney disease are dependent upon those programs for their access to health care. About 80% of people who are in kidney failure are in fact on Medicare, and about almost half of those are also dually eligible for Medicaid. So these are really important, very important programs for the populations that we serve. And we intend to be very actively involved and engaged with our patients in supporting those programs, and trying to make sure that policies are enacted at the federal level, at all levels, to support people who are dealing with kidney disease. So let me just pause there and see whether there are any questions.
Feel free to raise your hand or go ahead and put a question in the chat. But to get the conversation started, Ms. Burton, I'm curious, what is your advice for young doctors who are really interested in addressing these disparities, and specifically APOL1 mediated kidney disease?
I think that my best advice would be to look for particularly research opportunities, whether there are research opportunities through the federal government or through some of the pharma companies, to become involved with research that's going on with the development of medications that are being developed in this space. And the American Kidney Fund also has a clinical scientist and nephrology program. We award 2 fellows a year for people who have a research project that they can work with under the guidance of a member of their medical faculty. And the fellowship will help to cover the cost of their research, attendance at professional meetings, as well as obtaining a master's degree in public health or some other related field. We want to encourage people to stay in the clinical research field. Nephrology is an area where there has not been, if you look over the last several decades, generally, there has not been a lot of innovation. And we are beginning to see more happening now. We want to do everything that we can to encourage and support the continuation of that. Our fellowships are awarded at the beginning of each calendar year. And so around midsummer, we will make the announcement and give the deadlines for submitting an application to be considered for those fellowships.
Great. Thank you so much for sharing. Does anyone in our audience have any questions for Ms. Burton here? I'm going to go ahead and stop sharing my screen. Great, thank you. And then one more question. Can you talk a little bit more about some of the other programs going on at AKF?
Right. We have a full range of programs. Our tagline is fighting on all fronts. And the reason that is our tagline is because, we start with, as an organization, we started as a group that raised money for people who were dealing with kidney failure to help them pay for their dialysis in the days before Medicare provided coverage for people with end-stage kidney disease. But we know that people need so much more than that in order to have a successful journey in dealing with this disease. Over the years, decades actually, we have expanded our programs. We focus very much on, upstream care. We want to identify people, get people who are at risk, but who do not yet have the disease, so that hopefully they can get into care if they're at high risk or if they're at an early stage to either prevent or slow down the progression of that disease. So we have, community outreach programs, education programs, working with other partnerships to do that. We have a number of education programs, and I would highlight one in particular for this group, which is our Kidney Coach program. We certify people in the community, not necessarily people who have medical backgrounds, but some of them do. And we will certify, we provide the toolkit, the materials that they can use in their community settings, and the training that they need to go out and talk about kidney disease. And that is available to anyone who's interested in this. We've got over 7,000 coaches around the country and growing. So I would very much encourage this group as a way of consolidating what you all probably already know, or much of what you already know, into a toolkit that you can use to talk with others about the kidney disease. And we have a number of other programs in our education. We have a kidney kitchen that is designed for patients to help them, prepare kidney-friendly meals. We have an effort called Unknown Causes of Kidney Disease, where we focus on rare kidney diseases, of which AMKD is one. We have an annual summit with regard to that. We have another summit on patient access to talk about the issues, the challenges that patients have in getting the care that they need. We have a very active advocacy network. I mentioned that earlier. To work with all levels of government, to work with the media. We want people who make decisions, influencers, to understand what it's like to live with kidney disease and the risk of kidney disease, and what they in their various worlds, whether it's legislators or the media, can do to support that. And so, we continue, we have a very active awareness building program through our communications and marketing. We work with pharmaceutical companies in terms of making information about clinical trials available to patients so that they can make informed choices. And we educate them about questions that they should ask as they consider whether or not they want to be part of these trials. And then we're very active with regard to medical and clinical standards of care that impact patients, and participating in groups like the American Society of Nephrology and others that are dealing with those kinds of issues. So we have a full range of programs and activities. And finally, we are actually the largest organization in the country in terms of the dollar amount that we provide in financial assistance to people dealing with kidney disease, to help them pay health insurance, to help them deal with natural disasters, to help them with some of the out-of-pocket costs that their insurance won't cover. We're providing assistance to about 1 in 7 people who are on dialysis or who recently had transplants. We actually pay through our programs and through our by paying people's insurance, we're covering the cost of about 130 transplants per month, or about 7% of the transplants that are provided in this country on an annual basis.
Wow, thank you so much. That is incredible. And I really appreciate you kind of bringing in the legislative piece, the patient piece, the financial piece, kind of touching from every single different points and viewpoints and different industries that are involved in this. So doing amazing work over there at AKF, and I will connect with you and your team as well to get some of those resources and send them out to the students after this as well.
Okay, thank you all so much and have a very good evening. I apologize that I won't be able to stay. I'm going to go back to this other National Minority Quality Forum dinner that I'm involved with. Thank you so much.
Thank you so much for being here.
Okay, goodbye.